Duvizat is a prescription medicine for the treatment of Duchenne muscular dystrophy, DMD, in people 6 years of age and older. It is not known if Duvizat is safe and effective in children under age 6.
Understanding how medicine works can be tricky, especially when it comes to Duchenne, a rare genetic disorder that mainly affects boys. Let's start by explaining what's supposed to happen in the body. It can help you better understand how Duvizat may help people with Duchenne. Muscles allow the body to move by contracting and relaxing. When muscles work to produce movement, they develop small tears. Normally, muscles are able to repair these tears with the help of enzymes. Enzymes are special proteins that have many important roles in the body. One of their key roles is to help muscle tissue grow, repair, and stay healthy. One of these enzymes is called HDAC. HDAC is important for keeping muscles healthy. But in Duchenne, HDAC doesn't work properly. This contributes to muscles also not working as they should. Instead of normal muscle tears being repaired, they are often replaced with fat and scar tissue. Over time, this weakens the muscles, which can make it more difficult for people with Duchenne to run, jump, and play.
But why is HDAC affecting muscles this way?
Good question. Instead of helping muscles like it normally does, HDAC becomes overactive, or does more than it should in people with Duchenne. Overactive HDAC can cause a lot of inflammation in the muscle tissue. Inflammation is the body's way of responding to an injury. For example, when you scrape your knee, it might get red and swollen as your body works to heal. But in Duchenne, ongoing inflammation contributes to muscle damage, leading to more fat and scar tissue, which gets in the way of muscle repair. That's where HDAC inhibition comes in. Duvizat is a type of medicine called an HDAC inhibitor. It is thought to work differently from other medicines for Duchenne. It is designed to reduce HDAC overactivity.
While the exact process is unknown, it is thought that Duvizat reduces HDAC overactivity.
Duvizat is a non-steroidal treatment indicated for Duchenne muscular dystrophy for people 6 years of age and older, regardless of their genetic variant or ability to walk. I hope this helped you understand how Duvizat may work. Talk to your healthcare provider to learn more about Duvizat or visit duvizat.com.
Indication. What is Duvizat? Duvizat is a prescription medicine for the treatment of Duchenne muscular dystrophy, DMD, in people 6 years of age and older. It is not known if Duvizat is safe and effective in children under age 6. Important safety information. What is the most important information I should know about Duvizat? Low platelet counts in your blood, thrombocytopenia. Platelets are important for blood clotting, so having fewer can increase your risk of bleeding or bruising. Your doctor will check your blood count before you start Duvizat and regularly during treatment for signs of thrombocytopenia. Call your doctor right away if you notice unusual bleeding or small red or purple spots on the skin. Increased levels of fat, triglycerides, in your blood. You may not have any symptoms, so your doctor will do blood tests before you start Duvizat and regularly during treatment to check your triglyceride levels. Frequent watery loose stools, diarrhea, and vomiting. Duvizat can cause vomiting and moderate to severe diarrhea. If diarrhea occurs, you should keep track of the frequency and severity of your symptoms, drink plenty of fluids, and contact your doctor. If thrombocytopenia, increased triglycerides, or diarrhea cannot be managed, your doctor may change your dose or stop your treatment with Duvizat if needed. Before taking Duvizat, tell your doctor about all of your medical conditions, including any heart problems or medicines you take that could increase your chance for irregular heart rhythms, any bleeding problems. What are the possible side effects of Duvizat? Duvizat can cause serious side effects, including changes in the electrical activity of your heart called QT prolongation. QT prolongation can increase the risk of developing a type of irregular heart rhythm known as torsade de pointes. Call your doctor right away if you feel faint, have an irregular heartbeat, feel dizzy, or lose consciousness. See the section titled, What is the most important information I should know about Duvizat for more information about side effects. The most common side effects, occurring in greater than 5% of Duvizat-treated patients, included diarrhea, abdominal pain, low platelet levels, nausea or vomiting, high triglyceride levels, elevated temperature or fever, muscle aches, rash, joint pain, fatigue, constipation, and decreased appetite. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information and medication guide at duvizat.com.
Well, that brings us to the end. Thanks for learning more about Duvizat.